Welcome to this edition of Phenomenal Health. I'm Dr. Jeff Hawkins. Today we're going to be discussing the most popular non-surgical treatment for pain in the United States. If you're suffering with any kind of pain and you're looking for a natural way to treat it, then you better stay tuned. You're really going to love this show. Don't go away. We'll be right back.
Welcome to Phenomenal Health. Phenomenal Health is informative and exciting. Phenomenal Health interviews leading experts in all areas in healthcare, so you become a much more informed consumer. Now, here's your host, Dr. Jeff Hawkins.
Welcome back. I'm Dr. Jeff Hawkins, and you're watching Phenomenal Health. I am very fortunate to have with me today Dr. Kyle LeBlanc, who is a doctor of chiropractic. Dr. LeBlanc graduated from Logan College of Chiropractic, one of the best colleges in the country, and is a board-certified doctor of chiropractic. Dr. LeBlanc is formerly the team chiropractor for a professional sports team, and Dr. LeBlanc has been practicing in the St. Louis area for the past 3 years. He's here today to discuss why chiropractic has become the most popular non-surgical treatment for pain that exists today. Dr. LeBlanc, welcome to the show.
Thank you for inviting me.
I want to really thank you for taking some time with your busy schedule to come on. I know you're busy, and I really appreciate you coming on so you can share with the people of St. Louis exactly what chiropractic is and why it's become so popular. So the first question I have for you is, why did you decide to become a doctor of chiropractic?
Well, I was fortunate to be born into a chiropractic family where my grandfather was actually a chiropractor. Not only is he a truly gifted chiropractor, but also an extremely special person. I would grow up and spend time in his office where I would meet his patients or meet his patients out in public, and I would hear the amazing stories and just the changes that he made in people's lives. Okay. And I just thought, this is amazing. This is exactly what I want to do. Okay. I knew that if I could treat people the way he did, if I could make changes in their lives, if I could get them out of pain, that I would never consider going to the office as working a day in my life. Okay. And to this day, I still haven't.
That's great. Now, why, in your opinion, doctor, has chiropractic become so popular? Because I know in the last 15, 20 years, it really has become the most popular non-surgical form of pain relief treatment. Sure. So why has it become so popular?
Well, the bottom line is that chiropractic works. Okay. Chiropractic has been shown study after study to be the most effective treatment for spinal problems. I think people are sick and tired of pursuing different forms of treatment that just don't work. Ultimately, if you go see a doctor and you seek treatment, you want to know that that treatment that you're going to receive is is going to work. Right. And I feel that's what we actually provide to our patients.
Okay. So I want you to tell people that are watching right now that maybe have never been to a chiropractor, explain to us exactly what it is, how it works.
Sure. Well, chiropractic is a branch of the healing arts. We're concerned mostly with human health and with the disease process. We study primarily the central nervous system, and we work with the musculoskeletal system. Okay. We're able to detect misalignments in that system, which might be causing pain or different problems. Through correcting these misalignments, we're able to reduce the amount of pain, returning the body to its natural state without drugs, without unnecessary surgery, so that the body can then heal itself.
Okay, that's critical. I think everybody right now that's on the wellness movement doesn't want to have to take medications. They don't want to have surgery. Absolutely. So I think chiropractic has just positioned itself as a leader in that field, and it's phenomenal.
Absolutely.
So why don't you go ahead and demonstrate for us now on the spine. I know you brought one with you. Can you kind of show us how that works?
Absolutely. All right. As we're looking at the spine, we're looking at the head up in this area here, and we're looking at someone from the back. When we look at the spine, we don't want to see any curves from side to side. We want to see a straightened spine from front to back. But as we look at the spine in this direction, we want to see these natural curves that occur and work as shock absorbers. Now, what happens a lot of times when there's a misalignment in the spine, you can actually see where we put pressure onto a nerve.
Okay.
We can actually reduce that restriction and that misalignment, taking the pressure off the nerve and often getting people out of pain.
Okay, so when you do that, when you're moving that bone, taking the pressure off the nerve, how do you do that?
Okay, what we actually do, the most important part to understand is that proper diagnosis is the most important part. Okay. Finding out where that problem was located, exactly what the problem is. Right. We then use specific low-force adjustments to correct that problem, to restore the body to its natural state. We also work with physiotherapy to reduce overly tight muscles and to strengthen weak muscles as well.
All right, now when you do that with your hands and you actually, whatever it is you call it, I mean, how does that feel?
Sure.
And what do you call that when you do that with your hands?
Okay, we actually call that an adjustment,
okay.
A chiropractic adjustment. And to answer how it feels, I can speak on this firsthand because not only am I a chiropractor, but I'm also a chiropractic patient as well. And it feels amazing. If you have a problem in your body causing pressure on a nerve, where it's actually causing pain or discomfort, and you actually get that problem corrected, it takes pressure off the nerve, it feels tremendous. Right. On a daily basis, I have patients coming into my office telling me just how wonderful that feels and how they've been looking forward to their appointment all day long.
Okay. Now I know when we talked before the show, you told me that your office really specializes in not only getting people out of pain,
sure,
but also correcting the cause of their problem so it doesn't keep coming back over and over again. So explain to us how that works.
Sure. The best way to handle this is probably with an analogy.
Okay.
If you have a pebble in your shoe, are you going to wear crutches to take the pressure off of that foot? Are you going to wear thicker socks? Are you going to, do something such as pain medications to eliminate the pain that you're feeling in your foot? Or are you going to actually remove the pebble from the shoe?
Okay.
Now, a lot of times what people are doing is they're taking drugs and medications to mask their symptoms. Now, those are just symptoms. We actually eliminate the cause so we can eliminate that problem from returning.
Okay, so that makes sense. So instead of just treating it like medications do, you're actually going to look and see what the underlying cause is.
Absolutely.
And once that's fixed, then the problem goes away.
That's what we hope for.
Okay, well, that makes sense. Now, why don't you talk to us a little bit about your computerized technology that you have in your office?
Sure. We have an extremely advanced chiropractic office. We do multiple different types of testing, computerized testing. Two that I'd like to focus on. One that we do is called a thermography scan. We're actually able to scan the patient's back. Now, heat is given off during any bodily process, but when there's a pathological process, pain, inflammation, swelling, muscle tension, stress, it actually is given off in a higher amount. We're able to scan the body and find out where and to what extent that these patients might be having their problem. Okay. We also have a digital x-ray suite in our office, which is one of the few offices in the entire country that has this type of technology, so that we're able to take x-rays of our patients and enhance these x-rays through computer imaging and instantaneously show these to our patients so they can not only see where their problems are again, but what their problems are.
Now, both of these tests that you just explained, can you do like before and afters on these so that you can really show the person how they're progressing?
Absolutely.
Right, because I know that's a really big thing now too, that people just don't want to be told by their doctor they're better. They want to be able to see something, either a computerized test or some kind of report that shows them, okay, here's where I was when I started, and now here's where I am after a few months of care. Look at the difference. Okay.
Absolutely.
Okay, great. So do you have a special gift, doctor, you want to give people that are watching the show tonight?
Sure. Anytime I do any type of speaking arrangement or lecture, what I like to do is invite the audience to come on in and speak with me personally, to find out if chiropractic can actually help them with their problems, with their pain, with their condition. We'll sit down, we'll discuss their condition, we'll do a full examination, and we'll also do a computerized examination to find out what their problems are and where their problems are located.
Okay, I appreciate you doing that, Doc. That's a great offer, and I encourage people watching to take advantage of that. We have to take our first break right now. When we come back, we'll continue talking about this, okay?